According to the National Brain Tumor Society, there are more than 120 types of brain tumors, but the symptoms can vary widely. We spoke with Dr. Sharief Taraman at Children's Hospital of Orange County and asked him what type of condition could mimic a brain tumor.
That's a condition actually called pseudotumor cerebri. The word tumor means mass, and pseudotumor would mean a false tumor. And that's a condition in which patients have a variety of symptoms that present as if they had a brain tumor. This is actually a condition that can affect all age groups. It affects children. It can also affect adults. It's most typically seen in adolescent females or older women, and those that typically are actually obese.
What are the symptoms a patient can experience?
Patients will complain of either blurred vision, double vision. Sometimes they'll actually even have problems moving their eyes in certain directions. Other symptoms include nausea, vomiting, severe headaches. But again, the visual complaints are really the primary and most concerning problem that the patients present with. If your cerebral spinal fluid balance is somehow abnormal, then you may present with these types of symptoms. It's not so bad that you get a condition called hydrocephalus, which is an extreme pressure due to increased fluid on the brain, but it is significant enough that it does cause those symptoms. The exact cause is not known. There's a number of things that sort of can trigger a pseudotumor cerebri scenario. Those include sometimes patients are using a vitamin A supplement, sometimes steroids, either the use of or the discontinuation of them. Sometimes patients who are also, again, like we mentioned, overweight, are at risk for having this condition. So oftentimes patients with these symptoms will end up having an MRI of the brain. This will often be triggered not just because they have the symptoms, but there's a specific finding that we see on physical examination called papilledema. And that's actually when we do a fundoscopic exam or look into the back of the eye, we can see that the nerve, the second cranial nerve, is swollen or affected by this pressure that's accumulated in the brain.
Dr. Taraman talked about the treatments for the condition.
The primary medical management of this condition is using medications that help reduce the amount of cerebral spinal fluid that's being circulated in the brain. And those are called carbonic anhydrase inhibitors. The mainstay of that would be acetazolamide. If that fails, or if we are concerned that the vision will be significantly affected, or we're trying to prevent a patient from actually having blindness, which is a severe complication of this, then sometimes we employ lumbar punctures, not only in the diagnosis, but also in the management to take off some of that excess fluid to try and normalize the pressures. And sometimes patients will actually need even further interventions, which are surgical in nature. One of those is called an optic fenestration. That's a procedure in which the sheath that surrounds the second cranial nerve, the one that controls your vision, is actually sort of opened up, again, to release that pressure that's happening on the nerve itself. And then sometimes patients will also have a sort of a permanent lumbar drain placed, which helps to constantly drain the fluid rather than a one-time lumbar puncture procedure. As a medical community, we've been actually very successful in treating this, not only because we pick it up very early before the visual symptoms sort of get out of hand, but just even recognizing it in general. I think the challenge that we have as a medical community is the rising rates of obesity in the United States and even worldwide, because that is probably the largest contributor or factor that puts you at risk for having this disorder. And even a modest reduction in weight, 5 pounds, may have a significant benefit on patients whose primary risk factor is the obesity.